I have this genetic mutation, which basically makes me more probable to get breast or ovarian cancer, like much more higher probabilities, 50%.
Visited a gynecologist to know I had a question about my menstrual health, and she just said, come back to me when you want to get pregnant. And I kind of tried to ask again that, no, pregnancy is not my concern right now. I am not planning for it. But this is my concern. Can you kind of address this? But no, this is not important. I came back, I shared with my friends a group, and went like, this is what happened. And then everybody else was like, yeah, this is what happened with us too.
Welcome to Berry Naari with your podcast hosts Saraswati and Aditi. One, a chai-loving engineer from Bangalore, and the other, a beer-sipping economist in Berlin. Join us and our expert guests as we enter the vibrant world of Indian women through the power of data and stories.
Hi everyone, welcome to the new episode of Berry Naari. Today we have a really special episode with us where our guest is Saraswati, the founder of Cranberry. Hi Saraswati.
Hi everyone.
Today we thought like Saraswati and I, we really want to share with all of you, about women's health, why we decided to build in this space, why we are building Cranberry, what we've learned since the last 1 year, and of course where we see ourselves going and our vision for women's health. Excited to do this with you, Saraswati.
Yeah, I'm also super excited. We've always wanted to share our journey, and I think we have been doing that with our newsletter and with all the LinkedIn posts that we do. But I'm also excited to share almost a summarized version of what we learned over the last 1 year of speaking with different people, learning more about it. So yeah. So Aditi is also a guest for this. So we are going to interview each other for today.
Of course, I'm going to speak a lot and not let you speak. No. No.
And you must. You have done so much work in this space even before we started Cranberry. So I am excited to also hear in detail all the things that you have done.
Yeah, thanks so much. Amazing. So I think like one of the very common questions I get, Saraswati, is like why we are called Cranberry. I don't know if we've discussed this on our podcast yet. But why is that? Why are we called Cranberry?
It's interesting. So we've definitely always disputed who came up with the name. I think it was three of us who were brainstorming names, and then the name came up about it. And now we are like, oh, but who did come up with it finally? We don't have a record of it. But the name Cranberry came up because we were working in the women's health space and we wanted something that signifies red. And cranberry as a fruit is red in color. It's also associated with women's health because it's a fruit, or its juice is often recommended for improving urinary tract infections, also known as UTIs. Cranberries also grow in a bunch, and building a community or communities of health is a big part of how we think health problems will get solved, especially preventive health will get solved. And lastly, as we started building in health space, we realized how loaded the space of health is and how much it always creates the sense of, something is wrong and that's why you have to do something. And we wanted something that's light and makes you feel just fun and light about taking care of your health. Then we kind of zeroed in on the name after a lot of potential names. We said, okay, Cranberry kind of gets us there. Yeah.
Yeah, amazing. No, that's really well put. I think I really like the name now. And whenever like we speak to so many women and, a lot of women recognize, oh, cranberry, UTIs. And then when I say like also because they come in a bunch and even though we're building a very AI product and company, we are so, excited to be building these micro communities, and, the human touch is so important for us as well. And then
Absolutely.
I think, that's always a good, so to say, connection to make with the name. That's a great.
I also love the name because, something that you hate me for, but I love the puns that comes with it.
Yeah, true.
So Very Naari being one of them, and I always use very as a replacement for very. So very women, very good, very good day. So I often do that, which annoys Aditi, but I love that we can do that with this
No,
name.
I've started embracing it actually a bit. Or yeah, a berry bit. Okay, that's not a thing, but yeah, I like no, and it's actually yeah. Do you also want to tell how did we come up with like so our chatbot is called Berry, and yeah, and I really like that name as well now. I think there's no dispute
It was
there
a
who came up with the
name.
name.
Yeah. So it was the women who were already using the chatbot.
Hmm.
We asked them and again gave them a few options, and I think unanimously Berry was chosen by all of them. Although it was actually not chosen by us. For us, it
Yeah.
was not a good option. But yeah, they chose it, and now it seems to be picking up. So Berry is our chatbot, which is powered by AI and our health database, and it's accessible to anyone on WhatsApp to discuss and ask questions about menstrual health.
Yeah,
And we'll put the
amazing.
link here so that people can access it.
Oh, true. Yeah, I think we like our early, members. They come up with the best ideas, and I think like Betty is one of them. So, yeah, can't take credit for anything yet in this whole company.
Welcome to the founder's life.
I the only really okay. Now you're telling me this, Sarah. Yeah, okay. I think the only thing I can take credit for is my past. You know what I've done. So, yeah. So I think you were touching about like my past work in women's health and health in general, and so I think yeah, for me it's been like a pretty long journey getting into women's health. I started working on in gender inequality almost 10 years ago. With my PhD, I was looking into sex selective abortion and how much bargaining power or say women have in households. And then through that, I was like, oh my God, like health really seems like a domain where women outcomes are really bad. In particular, I was looking at maternal health. So India has done really well where the maternal death rates has come down, but they're still one of the highest in the world, and we have a long way to go. So yes, there I started working with the government of Uttarakhand, in particular on maternal anemia, because that basically leads to high risk pregnancies. And I think I was
What's
like
maternal
really amazed.
anemia? Can you
Huh?
share a bit more? What's
Yeah.
maternal anemia?
So, around 70% of women in India are anemic. That means the hemoglobin in our blood is lower than the level it should be at, so lower than 12. And a lot of women are even severely anemic, so under 9, where actually you feel a lot of fatigue and really low energy continuously in your life. And so, in during the pregnancy time, especially early pregnancy time, because you have another thing growing inside you, you need much more higher levels of hemoglobin in your blood anyway. So during your pregnancy time, if you're anemic, it's called maternal anemia, and that's what's called like leads to a high risk pregnancy. So because of that, it poses danger both to the mother as well as the child. Yeah.
Okay.
So it's of course like a really key thing. Everyone in the ecosystem, the government wants to improve. So it was like a really clear health parameter. Like I was working with the government of Uttarakhand towards improving on. I think it was really a puzzle for them because they give free iron supplements to women who are pregnant, and still the rates don't go up. So the question was like, are women not taking them? What is happening there? Yeah, and that's how I got into the whole field. Spent like I think around 6 to 8 months in the villages in Uttarakhand in a specific district. It's so beautiful. So I was always like, I'm so lucky I come from such a beautiful state that I'm like, oh, I'm going to work there. And people are like, cause it's really beautiful. And I'm like, yeah, maybe.
Someday.
Yeah. Yeah, and I think that like really it became clear to me that there is so much to do in women's health. That was just a small part of it, and So yeah, I think I was quite sure that I am ready to dedicate like my life and my work to this. And I think that really inspired me working on the ground also with a lot of the local clinicians and practitioners and ASHA workers and everyone in the local ecosystem. Like they do so much and an impressive job. Yeah, so I think that was like an inspiration for me getting into it. And yeah, I'm so excited now. I can build this, use through tech and data, so it can really be done at high quality at scale. I think that is exciting for me. Yeah, what about you? How come you
Amazing.
got into women's health?
There's so many, I think there's so many paths that led me to it. But I think I just remember this meme that I saw on the internet where this mother is saying, my teenage daughter just went into the bedroom and slammed the door when I told her that she has to bleed every single month for the rest of her life. And then my instinctive reaction was, oh, she hasn't seen everything yet. Because like menstruation is just the start of things. And a lot of it, like I started seeing how my body was changing constantly from my early teens to 20s to my 30s. I saw how my mother's body was changing constantly, from 30s, 40s, 50s, where she's right now. And just this idea of like the body and the symptoms are really changing throughout life. And there has to be something that guides you through it, because it's not just one time, oh, go take care of it, or like do this thing or finish this thing. So I was curious when I met you. I think this was in my sabbatical time. You were already working in the preventive health space, and I think together we started researching about women's health overall, and just looking at, can you really like draw out patterns of symptoms across the lifetime, like do something with it, like make healthcare recommendations much more personalized. And I think personally, I also, happened to visit a doctor around that time. Again, sabbatical time, so I was clearing off all my health debt, getting basic checkups done. And I just wanted to understand about where my health is, and visited a gynecologist to know I had a question about my menstrual health, and I had a barely 2 to 3 minute consultation. I think I didn't have whatever concern I had was not something of importance to the doctor. And she just said, okay, when you want to get pregnant, take these tablets and come back to me when you want to get pregnant. And I said, and I kind of tried to ask again that, no, pregnancy is not my concern right now. I am not planning for it. But this is my concern. Can you kind of address this? But no, this is not important. And then she kind of gave again a 1 minute lecture of like why I should plan the pregnancy sooner than later. And I was just like, I came back, I shared with my friends, a group, and went like, this is what happened. And then everybody else was like, yeah, this is what happened with us too. So, and the more people I started sharing it with, I just realized that how friends group become almost like your solidarity group, support group, when you don't receive support from the healthcare system. And I'm doing it with my friends, and my mother is doing it with her sisters and her co-sisters, and then just like that group, like just talking to them and kind of solving it amongst themselves. And that did not seem right. And I was like, okay, we have to do something about it. This can't just be something that women are solving amongst themselves. Also, that's why I think building community became such part of how we were solving it, because women are already solving or seeking support through communities to solve their day-to-day health challenges, whereas healthcare tends to address more of fertility or issues around fertility. What has been exciting learning? What has been the most eye-opening learning for you in the last 1 year of building Cranberry?
So I have two. One of the really severe big ones is that I think I really underestimated, like, the intensity or the severity of pain women are going through. So like in particular, endometriosis, which is a condition where the lining of inside the uterus grows up in different parts in the pelvic area, and during your periods and before that it can lead to really severe pain. So I always knew this, and I always knew the statistic that around 10 to 15% women in the world and in India have this condition, who are still not diagnosed, maybe a lot in India. And so I always knew this, but I think I did not understand. So that means around 35 million women in India. That is a lot.
A
So I think
lot.
for me,
Yeah.
Anyway, so my mind was always blown by 35 million women in India. That's a lot. But then, like, once I've started understanding by purely talking to women, like the intensity of this pain, then I'm kind of like, okay, 35 million women, which this much intensity of pain is like, insane. And I have to frankly say that just because I don't go through that pain, I was not able to imagine it and not truly be empathetic to it. So I want to tell you, was speaking to one of my friends who got diagnosed recently, and she was just saying that during her period, she would just lie in her bed. She can't do anything. She can't work for those 2-3 days. There's no way. And
Okay.
she was just lying in bed thinking, this is period pain. Everyone must be having it. She always thought, oh, my pain threshold is low somehow, that I'm not able to work, but all the other women seem to be going
Which
about
is
their
most
life.
women that we have spoken to, like, told us, right? Like every time every single user that we have spoken to and asked them, how's your period pain? They're like, oh, no, mine is not as bad. I can still like take 2 painkillers or 3 painkillers, or like I just have to take rest for the first 2 days, but rest of it is fine. Or even things like, this thing runs in my family, everybody faces it. So it's really the messaging that women have been receiving for a while. But yeah.
That's a great point. I think at least I personally also did that. And it's really human to do it, that you normalize based on what you see. And because a lot of these things are genetically related. So you've seen your mother, your aunts have similar things. And then you're like, हाँ मतलब मम्मी को भी तो इतना दर्द हुआ था, वह उनने भी बोला था, कोप किया था. So so you really normalize it in your head. But yeah, so like I think speaking to my friends, and then I spoke to another couple of like women I know who have endometriosis, and then I was just like, okay, this severity of pain where women are like, some women are stopping to work, some women are taking 2 days leave from work every month. I'm like, okay, this is insane. Like, it is also a very deep problem apart from huge problem. So I think this was my own ignorance. And in the last year, it has like totally transformed how I look at it. I don't know, maybe you already knew about it.
For sure. I think, but I agree. I think the extent of it has been a learning experience even more. So because we always started with the thesis, knew that there's this pain point, but just seeing it firsthand, talking to women has definitely opened up more.
Yeah, I think, so for me personally, that has been like a big learning, eye-opening thing. And I think, like, as I talk to more about it to people, like even like say men also, I think they are as well surprised and, so to say, shocked, like why didn't they know about it till now, and but happy to know it as well, that at least women are vocalizing and expressing this now. So what about, so that's like
I
the
have had
first
like, I
one.
think,
Yeah.
I think I have had learnings at multiple levels in multiple areas, because the whole field has been so new for me. I think started with this thesis that because I've worked in the space of data and personalization at scale, the thesis was that, you can take this women health data and symptom data and then really personalize healthcare information for them. But I think one on the symptom side, yes. So one is the severity of symptom, and I think looked into a lot of pain symptoms, but also came across the vaginal discharge as a big symptom, and how many women had questions about it. I mean, every workshop that we have been to or we have done, or we have spoken to women, there's always a question about it or how to interpret it and what needs to be done. So clearly a very big health marker for women, and more work needs to be done on that space. My second learning has been just in terms of evidence. I think both ways. One, that there is actually decent research done on preventive solutions that can help women improve their pain symptoms. And it almost feels like, why is this information not available to everyone on their fingertips, where there exists enough, like the study is done and guidelines have been published that you can do these things and this will really improve. And at the same time, there's this thing of like, oh, more should have been done, like bigger sample sizes, bigger sample sets of women, and there's so much more. Did know that I knew that the research is less, but then I think when you just see more, you're like, oh, it's really low. Like you definitely need better quality papers, better quality evidence and research. So I think that's been my second big learning, and really reinforces my in our bet that this chatbot will really help make that information accessible to a lot of women. The third thing has actually been very pleasantly great, has been working with doctors, actually. So the ones who collaborate with us, and they really, how much they are driven to solve for women's health. They have just been like giving their time, their information, talking to us, going through our medical protocols, going through our medical research, teaching us at times. Sometimes we just ask some of the silliest questions, and they are like, yeah, this is why this happens, this is why this happens. And so, we just makes it like, so there's like a huge room to collaborate. Like this, makes for a great case of like interdisciplinary collaboration, where they bring a lot of this health information. We bring the layer of science, we bring the layer of data and personalization, and like together we are able to like create this, which has been like, it's like both like been a great learning experience and been eye-opening. I think I definitely didn't expect that kind of openness. I thought it'll be like, we'll have to deal with like someone with like more closed opinions or not willing to talk or share as much, but they have been really open, both with their time and with their knowledge. So I think that's been a great learning in this space.
Yeah.
I think those are definitely the three.
Very interesting.
I think one more thing that I remember, it's been eye-opening in the sense that when I have done the workshops with women, or when we both have also done workshops, the vulnerability with which women open up about their symptoms, which really, I think, again, reinforces the aspect that they're really seeking information and not getting it. Because
so you mean that
our workshops have been...
You're surprised that they actually open up, because this is like a group interaction.
This is a group interaction. The topic of workshop has been generally about improving menstrual health awareness, but some of them have really opened up about like their personal health concern and shared what they are feeling and how they are feeling, and where can they seek solution, and that we have been able to guide them to the resources. But yeah, I think, you just reach that level when you're really seeking that solution, and you have not received it, and now this forum has opened up for you to like come and talk about it. We're like, definitely there's more information seeking behavior. Yeah.
Even though this is like in a work setting where like, Saraswati is coming and talking about menstrual health, people still ask like really personal questions, which we're surprised about. True.
Yeah.
And then more and more with the chatbot, actually, I think like I would be much more comfortable asking a lot more questions there, where it's a bit more discreet, especially around more than vaginal sexual health, which, even with about contraceptives and all. So, I loved your points, and I think, really fascinating, all the learnings. And I agree with all those points. I think it's been really amazing. So on the doctor's point, right? Like, so the other day we were having a call with a male doctor, and I think after half an hour, he's really great. He was like, oh God, I'm talking to two women about periods. Sorry.
And it was almost apologetic, huh?
Yeah.
Wow.
But it's great, like people in the ecosystem can come together, because given the scale of the problem, we need everyone. So yeah, that's a great point. I think it also shows like how like you have like quite a balanced approach, because in one way you can say that, okay, like some gynecologists were not empathetic enough to me. But on the other hand, we also have healthcare practitioners who are, like more than willing to build with us, right? So
absolutely, yeah.
That's really, I think, amazing. And that way, I think the Indian ecosystem, because I feel like considering I'm based out of Berlin, and what I see here is like there's so much, so to say, collaboration between hospitals and startups, like, like tech and experts and everything. And I think it's so great to see that now happening in India, at least with us, where, like these leading experts are, ready to come and, they're not seeing, tech and what we are building as a threat, but instead as, the future they want to build together
Yeah.
responsibly,
Yeah.
which
I
is
also learned a lot from you actually in the last 1 year. I think it's just about like
finally kuch bola.
I know you're just like waiting for it. Like let me. uh, I mean many things, but I think just being able to verify a good source of information. Like how do you judge this is a good information and this is trustworthy information, or this information is good enough to be applied in your day-to-day life? And I mean, in the beginning, we were always keen on kind of starting these preventive habits and helping women like build these habits. And kind of somewhere we steered the direction a bit to saying, okay, no, first, like let's give the information and make that information really, really transparent. And that transparency is another thing that I have learned from you, because I mean, you're very strong on being transparent about both the information and the women health data that we are collecting. Like almost every week or every 2 weeks, like, but like, okay, how are we, like, what are we doing with this data? How are we keeping it safe? Or how are we, like, how do we kind of give the data back to the women so that they have power on the information that's being collected? So I think it has really attuned my brain also to start thinking about it. And I think it's also impacting our product on how we are thinking about like just this information and making it accessible, making it trustable, sharing, finding out the information that's easy to trust or verifiable. Yeah, I think would be great to, I mean, would you want to share about like your journey of just like navigating through medical information? I know there's a lot of story there.
Yeah. So I think for me, that started like really 5 years ago. So before that, I think I never had like a reason to really properly get into seeking health information for myself. But my mom got diagnosed with ovarian cancer, and then like I went deep into it, like, trying to understand the methodology with which doctors are making decisions and things like that. Because, medicine is like super hard and everyone tries to do the best job they can. But maybe because I'm a control freak and I need to understand things, I really went very deep into that, like looking at the best resources. I have to say, like, doctors in India are becoming open enough where they are opening themselves to questioning, where you can have discussions with them, trying to, because I think like the traditional setup of lot of healthcare was of an expert giving you information, and it was not, forget empowering, it was like you had no agency over what information you're choosing, what you're getting. It
Yeah.
is what is in economics called, there's so much information asymmetry by definition, because here
Yeah.
are people who have all the information and you are at the receiving end. I think for me as a person, that just doesn't work. I feel helpless, I feel out of control. And so yeah, I had to take that more in my control when my mom got diagnosed. And I think then I have started building, rules or heuristic how I can judge things. Of course, I'm like already trained a lot in how to judge evidence, but then I also started like building skills on like how to judge if this piece of information someone is saying is true, or like with what probability are they saying it and things like that. So I think personally, then I also got I have this genetic mutation, which basically makes me more probable to get breast or ovarian cancer, like much more higher probabilities, 50% or something. Again, we can talk about that in a different episode. I'm super passionate, of course, about talking about that. And there also, like, so then because I live in Berlin, I had a lot of like doctor's appointments about that, about understanding there. So it's very interesting. Here, the system has transitioned a bit more to that, where they give me like a lot more information, try to,
Interesting.
enable me. They would explain everything and be like, it's still your choice how you choose to get your screenings done and everything. So it's a bit better, not still totally there because the information is very hard to understand and things like that. And so I think like that has really, so I mean, I was always working on women's health, but that whole episode was like, okay, I really need to urgently work on this with people who know how to solve problems fast, quickly, at scale. And that's where I have to say I'm learning a lot from you. So I've connected it back. Yeah, so I think because for someone like me, I think I would not be able to build this alone, because I would still have much more that expert view of, explaining things. And I think when we build together, you'll be like, oh, but we should just give the choice to the woman to choose her journey like this. I mean, she'll most probably discover everything, but health is loaded, it is overwhelming. And which I think, I am learning from you. Like, I think the two key points always come out is, okay, make it actionable and make it less overwhelming. And yeah, I think.
Yeah, but you still don't agree to dance on Instagram and show the health information.
Yeah.
Like that's
mutation 1, mutation 2, more probability of cancer. Yeah.
yeah, one day we'll get there.
I think for some topics I might do it.
Yeah, where you probably are just creating awareness, but I think that's been the other gripe that we have always had of how information comes on Instagram, which is very hard to reference or hard to kind of form a chain, like keep a track of, like just in general. And yeah, I think what's the best way to communicate health information in a way that it's less overwhelming, right? That's a big problem statement that we are trying to constantly solve and constantly trying to speak to people to just get better nuance of it. Yeah.
Yeah, I mean that space is looking exciting in India now with the Whole Truth, they're called, right?
Yeah, I really like what they're doing. Also, Dr. Cutress, I think she's done a great job of just sharing it much more contextual to Indian setting.
Yeah, she's really amazing. So I think, there's so much to do in that. And true, I think personally, I feel like how much agency I am able to get. I wish like all women have that, like really all, including like the women I worked with in Uttarakhand in the villages. I'm like, why should they have any less? I mean, it's not fair. Like, why should we just tell them to take these tablets and they should not know anything?
Yeah.
And because I think it's not like everything is so rocket science and people can't understand it and they shouldn't be told. I think that's like at least not like my worldview and belief. I think usually the experts are at fault of thinking like that, and so I'm super passionate and excited that we'll for sure be changing this.
Yeah, I think my vision really goes to, I mean, agency, of course. Like, I think that's the topmost priority. Like, how do we build more agency so that women feel that they're making informed choices and they have more control on their health? And the second thing, I think, or the way to go, the way we are going about it, or the way I see it is just like if they experience a symptom, they know what's happening with them, especially if it's a symptom that they're most likely to experience, like things like, so period pain and PMS is of course one. Then you have things like hormonal migraines, which start affecting women at a certain age. Things like hot flashes, which come when you enter your menopausal age. Things like urinary incontinence, right? When you leak some amount of urine and when you're coughing, and this can happen to anyone, whether you have been pregnant, you have not been pregnant. Even things like hemorrhoids. I mean, this just like likely to affect women a lot more.
Like post-pregnancy hemorrhoids, right?
Post-pregnancy, it definitely, and then even like pre-pregnancy. I mean, so it's definitely higher correlation with pregnancy, but it doesn't mean that only for that it happens. It happens otherwise too, and it's again like just the way our bodies are designed, and partly like how our lifestyles are evolving with time. And but it's just that like when it happens, it always feels like it's something that's happening only with you, and maybe you need to solve it, or what is this like embarrassing thing that I'm going through.
True.
And I just feel like women need to like reach a world where they know what's happening with their body, and then they kind of seek the solution from the required healthcare provider or doctor or exercise specialist or nutritionist based on like what's the problem with them.
Yeah.
Yeah.
No, totally agree. Like, yeah, I think I think we have so many learnings, but I have to re-emphasize again. I think one is both the scale of the problem and the depth. Because with migraines also, each time a statistic comes up, I'm so surprised that like 20 to 30% women have migraines, which is 3 times of men.
Wow.
Yeah, and now given I know this information, whenever I talk to women and like and I'll say something and they'll be like, "Oh yeah," and I had such a bad migraine that I have to shut myself in a dark room, and I'm like, "Okay, yes." Now I'm more empathetic to this. I think maybe women were telling me that earlier and I was not listening. But right? Right? So many women tell us all this stuff, right? Now I
Yeah,
know.
yeah, for sure. I think, but I agree with you that earlier it always seemed like that person's problem, and now
Yeah.
that the shift has happened, that when people share, like, oh, this is something that happens. Even with my mother, I think my conversations have shifted, and I think that really helps her because then she went, oh, but like this, I'm experiencing this symptom and I'm not comfortable with it. And my next response to it is, but like these many women actually experience this symptom. It's
Mm-hmm.
commonplace. And then she goes, oh, is it? Okay. So then I would seek solution. Let me like, so what is there also solution to solve it? I'm like, yeah. I mean, there are these solutions. Let's see if it solves for you. And then otherwise we'll visit a doctor. Whereas earlier, I think it would just be like, I'm having this symptom. I don't want to talk about it. I want to secretly wish that it goes away on its own.
True.
I don't want to see a doctor because, of course, I think visiting a gynecologist or visiting any doctor has its own
Yeah.
mental load that associated with it for her. And then I think at certain strata, it's also financial load for women to have to visit a specialist doctor. So yeah, definitely looking at how can we take this in more and more languages and more women just getting this information. So they just feel, yeah, I mean, they don't reduce the life that they are living. Like, stop
Yeah. No.
traveling, stop doing things, but actually be like, oh, okay, this is what happened, but I can just manage it in this way and live their life to their fullest, like truly.
Yeah. That's like, yeah, reduce their life. That's really well put, right? Like you close your circle and your space that you occupy uh,
Yeah.
because of all of these. Yeah. No, I totally agree. It's I think on the point of like bone surgeries, I think I keep bringing it back to like, knee pain
Yes.
all the time. Because I think that is something.
It was literally, I think, a vision statement of our company at one point that can we reduce the bone surgeries women are experiencing, because Aditi was really like, yeah, please tell us
Yeah,
why,
but
where,
why?
why.
So, because I think it just really started from like even like 10 years ago that I would see women in like the more senior generations than us, slowly, as you beautifully put, reduce their life. Because, matlab, we are going to Vaishno Devi, chal nahi sakte, not very old, but, knee pain is so common. And then I think as people have more money and access now, people start getting those knee surgeries, right? So, and then as I learned more about it, I was like, even in the US, like 1 in 2 women, like every other woman has like a bone surgery, which is insane, right? And
Yeah.
so I think this it's like, I think so it started with like I was personally scared. My vitamin D is always low. My calcium also, I think I know, is low. I've just started strength training in the last few years, and I'm like, oh my god, like, people are talking about longevity and everything, and I'm like, for women, it's like, I want my knees to work at 50, right? Like the benchmark is so low, I have to say, right? Because like,
Yeah.
I don't want to say like men are talking about longevity. Everyone is, but they're like, want to live till 100 healthily. And I'm like, here we are, like where I am at like fairly, I would say, like high risk of like having like bad knees at 50.
Mm-hmm.
And I'm like, how is that possible? Like, why and I do not want this for like, any generations of women going forward. So I think for me, that's why I keep talking about knee surgeries.
Also, makes sense though. I mean,
Hmm.
yeah, we hope to see an India where there are lesser surgeries,
No, definitely. I think our overall vision also of this, like from more sickness to wellness, I think
Yeah.
as the whole ecosystem is going, I think we are very excited to be part of that new, I would say almost like a health revolution globally. And I think that is really exciting. Uh,
I also find it very interesting that like how now that we work in this space,
hmm,
um, almost every person that we interact with, in whichever setting, whether it's like a general conversation or an interview or like a mentoring session, they're just so comfortable coming and sharing, just like opening the statement with like, oh, actually, I'm having really bad days. I'm having my periods today. It's just the first day. So, I mean, you people will understand. And I'm like, oh, this feels so normal, and why wasn't this happening before? Just like now it's the context and people are finding it's like, but
yeah.
this should have been just the case of like conversation anywhere. And it's amazing. We've just seen this trend with like everyone. Even in like
Hmm.
team meetings, we see people like coming and just going like, oh yeah, actually my energies or my moods are fluctuating today. And then you go, okay, sure. I
Yeah.
mean,
I think you draw this analogy sometimes between mental health and all these lot of women's health topics which are stigmatized. Yeah, and I really like that how you put that, right? Because now when we ask sometimes how are you feeling, people tell us how they're feeling.
yeah,
Yes, that's what you wanted,
true.
Saraswati. Yeah.
Yes. Yeah,
Yeah.
it's amazing. It's been a delightful new thing that's happening. So, yeah.
True, definitely. Uh, if I may go back to one of the learnings, no, not learnings you said, but your own experiences with like, especially doctors. So that's another big learning for me. So I think, especially in the US, they call it a lot like gaslighting. And I think now it's been like like almost been shown and that the healthcare system has been biased against women in their pain reporting in specific. There was this paper in 2001 called The Girl Who Cried Pain, which documented this and has been really, like a breakthrough movement in that women face a lot of pain, and they are often dismissed as having it in their head, and
Yeah.
the healthcare system not treating it properly. And so for me, again, one of the things I underestimated, because I think personally I did not like maybe have so many interactions, or because maybe I'm such a high agency person that I would anyway be like, okay, yeah, you don't know, I'll look it up. So but I think that's definitely like a totally valid point, which again I think needs to be spoken more about, and everyone in the society needs to know that people in the healthcare system, people like our partners, people around us, and there I got really fascinated by the term gaslighting, because it's used quite a lot, like the healthcare system has been gaslighting women. And there I just have an anecdote that I was super interested why it's called gaslighting. And basically it's a play from 1983 where the husband, what he's doing is, he's because they have gas lights, it's based in the UK, I think. So he's every day changing the the level of the lights in the house. So
Okay.
his wife is basically thinking that she's going crazy, like her perception of
Oh,
light is changing, and it's him just changing it all the time to play with her mind. And then she basically keeps saying that, oh, there's something wrong with the lights, it's not fine.
hmm.
And he'll be like, no, it's just in your head, you're just
Oh,
crying for no reason. And so
it's crazy.
basically, and it was like a huge play, and I think then it became a movie as well, and that's where gaslighting comes from. And I was like, oh wow, this has been going on for really long, and at some point of time it was totally okay to make that into a theater play. uh, but yeah, I think that really for me summarized it, that you say that, nah, this is not okay, I'm in bed in pain,
Yeah.
and we were like, nah, it's in your head, everyone goes through it, and dismissing, or I don't know, even
Yeah.
I guess what the case you said, where that time fertility is not your concern and you want to know about it. So for me
Hmm.
also, I thought like, so in Berlin when I go to the gynecologist, I told like that I have period pain, which I have to take painkillers for, like can I avoid that? I mean,
Hmm.
the doctor said to me, yeah, that's like normal, it happens to everyone, kind of cope with it, so to say. I would not say that. I wouldn't say that's gaslighting. Like, she's not saying you're not feeling it, but I
Yeah.
wish she had told me these guidelines or something, right? Which we are building now to tell to me.
Yeah.
Right. So I would, but put that in a lighter version of that. And maybe that's the healthcare system structural problem, that she doesn't have time. But I think
Yeah.
that means Cranberries really needed that to tell that to me, to you. Yeah.
Yeah, I mean, especially when you think, I mean, when you talk about it in general, you're like, oh, okay, 2 days a month, this is happening. But when you look at the lifetime of a woman, you're almost bleeding for 7 years of your life. You're living for like 50, 60
Really?
years. Like for 7 years of your lifetime, you're bleeding, which means 7 years of your lifetime is spent in pain, which could have been managed, or like at least reduce the severity of it, if not completely reduced. Like and that's a lot. Like 7 years of your life is just like being in pain.
Yeah.
And yeah.
That 7 years is a lot. Okay, that's like boom, blown my mind again. Okay.
Yeah. So this has really been the reason for us to do what we are doing at Cranberry, and how we see women's health and the role preventive habits can play in women's health. And there's really so much work to be done in this space. And right from like period pain, I mean, we just spoke about probably like 1/10 of the symptoms that women experience. There's breast tenderness, there's urinary tract infections, there's and then things that eventually lead up to like cancer symptoms. So, and I find it quite interesting when we speak to some people and then they go, oh, you're working in a very niche area, how do you think you will get like customers? And I'm really like, how do you not see, like, I have personally like been to so many like my personal healthcare expenditure and the expenditure that I have done for my mother, even though like we are completely healthy, just to kind of get the symptoms addressed, easily sums up to enough market opportunity. And if every other woman is spending this, then I think there's market opportunity in terms of billions, or like $1 million, millions of dollars that needs to be captured out there. We need to solve better for women. So there's so much work to do, and I'm quite excited about spending the next decade solving for women's health, and like one down and 9 more to go.
True. Yeah, one down, 9 more to go. Yeah, that's like a great point, because like in the US now we see these huge companies like Maven Clinic and Tia, which are like, going to millions of women and are unicorns. So clearly this is something to solve and work on. So excited to be doing this for Indian women to start with, and period pain and PMS to start with. But as Saraswati is saying that, there is so much more in the whole how we can help women prevent and manage what they're facing right now. This has been great, Saraswati. I think,
You've been a wonderful guest, Aditi.
I know that. Thanks for asking me like such good questions. I'm like really like, oh my God. I wasn't prepared with my questions. Okay. No, next. Yeah, great. I mean, thanks everyone for listening in. We are so happy that you're being a part of our journey and, sharing this space and, are involved in discussing these narratives of Indian women. We hope you continue to listen in, and yeah, that's it for now.
Yeah, thanks everyone for joining in. Bye.
Bye.